So welcome to the Coordinated Entry Refresher Training for 2021. My name is Lindsay and I'm going to get us started today. I'm joined by the HMIS Help Desk team as well as the Systems Change team. So let's all take a couple of seconds to put away any distractions like phones, close out our email. I know it's tempting to want to double task because of how much we all have on our plates, but we really want to ask that you dedicate this time and your attention to this meeting, as tempting as it can be to double task. We really want to make good use of this time that we've all carved out for each other. You know, since our goal is to house our clients as quickly and effectively as possible, we really want to make sure that everyone has the most up-to-date information and best practices for coordinated entry so that we can best serve our clients. Let's take a look at our agenda. So today our agenda starts off with us taking a quick tour of Adobe Connect and discussing a few housekeeping items as well as a couple of icebreaker polls. And then we'll begin our refresher training by walking through the how and the why of the entire coordinated entry intake process, including general workflow information, the VI-SPDAT, how to make referrals in the workflow, and unmet needs, excuse me. And we will then move on to how, why, and when to make CE statuses, how to find referrals that have been made to your agency, as well as an in-depth look at the provider profiles within that provider workspace. Next up, we will talk about when and how to enroll your client into a shelter or a housing project after their coordinated entry enrollment is completed. We will wrap things up discussing when and how to exit your client from their coordinated entry enrollment. And we'll finish up today's training discussing some next steps. Please feel free to ask any questions during the training in that chat box on the right side, but we will also leave some time at the end of the training for a little Q&A. So let's take a quick tour of Adobe Connect for those of you who are new. At the very bottom right corner of your screen, you can download today's slide deck. If you hover over the row that says June 2021 CE Refresher Training, you should see a little button that can let you download the slides. However, before you do that, I also wanted to say that today's webinar is being recorded and we're going to upload this to YouTube, and we can email you a link of that so you can just watch this video if you'd prefer that over downloading the slides. Above the files section, you'll see the chat box, which is here for you to type any questions in. We have a few THN staff who will be answering questions in the chat box as we go. Please ask questions. There's no bad questions here. If you're wondering something, chances are someone else is too. And I see some people are typing their names into the chat. That's great. We really only need you to type your name in if you don't see your name in that attendees pod, which is at the top right. So go ahead and take a second to just look at the list of attendees and make sure that you see your name, because if we don't see your name, we don't necessarily know that you attended today. Also, if you're sharing a screen with a coworker, you'll also want to type your name into the chat box so that we know you're here. If you have any coworkers who are not able to make it today, that's okay. We're going to put this into Litmus, a recording of it, into Litmus, and we will assign it to everyone who didn't attend either yesterday or today. And then also, if you don't want to type your name into the chat box, you can also just email us at hmis@thn.org, but it's probably easier to just go ahead and type it into that chat box right now. Okay, I think, oh yes, one more thing. If you're not a coordinated entry user, you do not need to be in attendance today. We had a few people in yesterday's webinar that had not gone through the coordinated entry training, so we just wanted to clarify that this training is really only for HMIS users that have access to that coordinated entry work group. Okay, I think we are going to do some icebreakers. So I am going to open this poll. I just want you to answer this question about how comfortable you feel with the coordinated entry process. Do you think you're a coordinated entry wizard? Are you fairly confident at coordinated entry? Do you think your knowledge meets expectations? Do you think it needs improvement, or are you really hoping to get some help and clarification today in this training? I'll give you about a minute to answer that. And yeah, for those asking, there's no submit button. You just kind of select one of those options there. All right, great. I'm going to broadcast those results just in case anyone's curious. So it looks like most of us are fairly confident or meet expectations or need improvement, somewhere in the middle. So that's great. No one answered help, so that's good. We got a few CE wizards, which is very exciting. Okay, great. And I'm going to transition back over to my slideshow. Okay, and I'm going to have one more question for you, but this time we're going to type it into the chat box so everyone can get kind of comfortable with that chat box. So in around 5 words or less, what is your favorite thing about your job? So go ahead and type into that chat box in about 5 words or less. We don't want a paragraph, just a few words about your favorite thing about your job. Great, we've got some good answers coming in. Making connections, helping others, being an advocate. These are great. Giving hope. Awesome. Thanks for doing that. Okay, awesome. Well, let's go ahead and kind of get started. As our agenda said, we're going to start with the coordinated entry intake process. So I'm going to pass things over to Katie, who's going to talk a little bit about the very beginning of the CE process.
Thanks, Lindsay. So let's get started talking about the intake process. I know for some of you this will be a review, but for some of you, hopefully this will be some useful information. So when somebody first walks into an entry point, what does that intake process look like? The first step should always be to check the household safety. We know that there's a link between domestic violence and homelessness, so it's important to determine if the household may want a referral for a victim service provider, abbreviated to a VSP. And if safety is the household's top concern, they could either go to a local VSP and continue with coordinated entry at a later time, or they could continue with coordinated entry at the VSP if that organization also serves as an entry point. And if a household would like services from a VSP, but safety is not really their top concern and they would prefer to stay at the current entry point, and then the assessor would continue with the coordinated entry enrollment and would also make a warm referral to a local victim service provider afterwards. So after determining if safety is the top concern, assessors should try to understand the household's current housing situation through an open dialogue with the household, asking questions such as, where did you stay last night? How long have you been staying there? Is it safe to stay there? Can help staff to better understand what services this household may need and if they are eligible for a coordinated entry enrollment. So assessors should then attempt a diversion conversation with the household. And diversion is a series of conversations and problem-solving strategies that work to connect households to resources already available to them. Assessors should attempt diversion with every household that presents for services. When a household seeks services such as emergency shelter, diversion helps them to identify immediate alternate housing arrangements, and when safe and appropriate, can connect them with resources to support their return to permanent housing. So what does diversion look like? As I stated, diversion is often a series of conversations and problem-solving strategies that will begin with listening. So it uses a trauma-informed and crisis resolution approach. It centers client choice, respect, and empowerment. It provides the minimum assistance necessary for the shortest time possible or the lightest touch so that we can maximize community resources for those who need more intensive services. Diversion is a type of homelessness prevention that is not always dependent on funding to be successful. Sometimes mediation or problem solving is needed to get someone back into their housing. So why do we do diversion? because it provides assistance earlier in a household's crisis. It can also improve the system effectiveness by reducing inflow and expediting outflow. It's important to note that diversion does not prevent people from accessing services. So some households will not resolve their immediate housing crisis or may not want to engage in a diversion conversation, and they can always access emergency services if they're eligible for them and would like a referral for them. The key is really to attempt the conversation, validate their experience, and listen for understanding. So the next part of the introduction process is explaining to the household what this process may look like. First, what is coordinated entry? Explain that coordinated entry is a process that will involve you collecting information to understand their housing situation, in the hopes of connecting them with resources in the community, either at your organization or at another organization that may be a good fit for them. Second, what is your role as the assessor? So emphasize that you are there to understand their situation, that there is no right or wrong answers to the questions that you're going to be asking. You are there to help connect them to resources in the community. Third, what will your time together look like? Explain that this will involve a conversation about their housing crisis and collecting information from them. You will also be asking them a series of questions to better understand their situation and their needs. Fourth, what is the outcome for the household? Be straightforward that this process will not guarantee them housing, but it may help you to understand what housing program could be a good fit for them, and depending on the community resources, you could refer them to a program that they may be eligible for. So I'm going to pass it back off to Lindsay to show us what this intake process looks like in HMIS.
Thanks, Katie. I am going to share my screen. You make sure that I'm sharing the right screen. Okay, we should all see HMIS now. Awesome. Oops, I got my notes pulled up on the wrong screen. Give me just a second. Okay, so now that we've kind of walked through the basics of getting started with coordinated entry, we want to get started in HMIS as well. So the first thing you want to do is make sure that you're in the right work group. Some of you, not all of you, have access to multiple work groups in HMIS, so we want to click on our name in the top right corner, and a little box pops up, and you'll just make sure that you are in that coordinated entry work group. Like I said, not all of you have access to multiple ones, but if you do have access to shelter housing or non-shelter work groups, you want to make sure that you've switched over. And once you've done that, click apply. Now we're ready to get started. So we'll always get started by clicking on the coordinated entry workflow button. And the first page that pops up, remember, is that counter, that pre-screening page. So this is sort of an anonymous page. It's not related to our client that's listed at the top there. However, it's really important that you do select the correct assessing community and entry point. I'm going to just pick Abilene since they're at the top here, but it's really important that you do take the time to select your actual community and entry point. And then you would ask your client, obviously, if they would like, the household, if they would like a referral to a survivor service provider. I'm going to say no for this, just to get us through. And then we come to this page where we can decide if we want to add a new client. Obviously, we would want to search the system to make sure that our client is not already in the system to avoid creating a duplicate before we just go in and blindly add a new client. Or we can use the current client, which I'm going to do. I see my client's name here. That's his client ID. So I would select this option. Or you can always select another client and search the system. All right. So I'm just going to quickly get through the first few pages of this workflow. I've already filled out my client's basic client information. There is space here for some more non-required information if you're able to gather that. If not, that's okay. Click Finish. Next we come to, my client track is being slow today, bear with me. We come to the information release and security page. This all looks good. Just review and make sure that this security restriction is set to the correct one. I'll click no changes here. And my client doesn't have any family members or household members to add, but if he did, this is where I would add them. Click Save and Close. And now we come to that HUD program enrollment page. So you'll notice that since we're in the coordinated entry work group, it automatically selects our project for us as coordinated entry. So we don't need to pick one. Whereas if you're in a different work group, you will need to select your project. We'll see that my client pops up below. I still need to click on his row though and make sure that that project start date looks good. For this training, I'm going to backdate this date a couple of days. Let's say I'm going to backdate it to Monday. I'm going to pretend like because of my capacity at work, I wasn't able to directly enter this data. So I'm actually playing a bit of catch up and I have to backdate all of my data to the 28th. And this will come in handy in just a minute. Everything looks good, so I'm going to click Save. Okay, so now we're on that Universal Data Assessment page. You'll see that this date field, the assessment date field, automatically backdated to my project start date, but I wanted to make it clear that not every date field in the workflow is going to do that for you. So it's really a good idea to just put eyes on every single date field and just to make sure if you're doing backdated data entry that date field matches. So this assessing community and entry point, you'll see that's already filled out for you as well. It pulled the data that we put on that pre-screen page. So that's why it's so important that we get that right on that very first page of the workflow, because it's going to automatically fill those in for you. You can change them if you need to. So I'll fill in my client's disabling condition. I'm going to say no. And then we come to this housing status question. Scroll down a little. You'll see that there's a lot of options here. And Katie's going to talk about different housing statuses in just a second, but I did just want to show you that if you're unsure of what one of these means, you'll notice that if you click on it, a little blurb pops up below with some more information about what that housing status looks like. So I am going to stop sharing and pass things off to Katie.
Thanks, Lindsay. So let's quickly define the housing statuses that are important to know for coordinated entry enrollments. First, HUD's definition of homelessness is broken down into 4 categories. So while all households are at risk of homelessness or all households that are at risk of homelessness or experiencing homelessness can access entry points, only individuals and families who are literally homeless, Category 1, or fleeing or attempting to flee domestic violence, Category 4, can complete a coordinated entry enrollment. Households that meet the Category 1 definition of literal homelessness would be an individual or family who lacks a fixed, regular, or adequate nighttime residence, meaning that they either have a primary nighttime residence that is a public or private place that's not meant for human habitation, or they are living in a publicly or privately operated shelter that's designated to provide temporary living arrangements. This can include congregate shelters, transitional housing, and hotels and motels that are paid for by charitable organizations or by federal, state, and local government programs. Or they are exiting an institution where they've resided for 90 days or less and resided in an emergency shelter or a place not meant for human habitation immediately before entering that institution. And households that meet the Category 4 definition of fleeing or attempting to flee domestic violence would be any individual or family who is fleeing or attempting to flee domestic violence and has no other residence and lacks the resources or support networks to obtain other permanent housing. So for this definition, Category 4 also includes dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions that relate to violence against the individual or family member. Families and individuals who are fleeing or attempting to flee domestic violence while living in their own housing or while living with friends and family are eligible for coordinated entry enrollment. So if a household, if their situation does not align with either of these 2 definitions, staff would not move forward with the coordinated entry enrollment in HMIS. Entry point staff should then attempt to connect the household with other available resources in the community that they may be interested in or that may be a good fit for their situation. And I will pass it back over to Lindsay to continue with the workflow.
Awesome. Thanks, Katie. I'm going to share my screen one more time. And we're back in HMIS. We're back on that universal data assessment page that we were just looking at. And now we have determined that our client is category 1, or I've determined that my client is category 1, literally homeless. And then we come to this question, COVID-19. Are you currently experiencing homelessness due to COVID-19? You'll notice if you select yes, there are a couple of little options here that you can choose, but I'm going to say no for my client. Client location will automatically be selected for you. And then we have these living situation questions at the bottom. These should look familiar if you've done other types of intakes. So there's a lot of options here. And I do just want to quickly remind you that we want to avoid this other section if we can. We want to try and find the situation that best fits the client's situation. And a few other questions are going to pop up here at the bottom. I'm not going to spend too much time on these, but I did want to remind everyone that this third question, approximate date homelessness started, refers to this specific instance of homelessness. It's not necessarily asking about the first time that your client ever experienced homelessness. All right, I'm going to click Save. And now we come to the VI-SPDAT or VI-SPDAT history page. If you're unsure about which type of VI-SPDAT you need to complete with your household, there's a lot of really good information at the top of the page here that can help remind you. So just really quickly, it says to complete the VI-SPDAT with households made up of only adults, and each adult individual will be assessed with the VI-SPDAT. However, if there's any children in the household, you would complete the FVI-SPDAT with households made up of adults and children. And only the head of household, the adult head of household, would be assessed with that FVI-SPDAT. So I'm actually going to pass things back off to Katie to talk a little bit more about the VI-SPDAT.
So before we go through the VI-SPDAT and HMIS, let's talk about some background information on the VI-SPDAT. And let's get into some detail on who created it, why it was created, and how it should be administered. So the VI-SPDAT and FVI-SPDAT were created by two consulting organizations, OrCode Consulting and Community Solutions. And these tools are publicly available and based on self-reporting. So these are the tools that we currently use for assessment in the Texas Balance of State COC. The VI-SPDAT is a quick triage tool that includes 27 questions, and the FVI-SPDAT includes 41 questions. These questions are divided into 4 to 5 different areas, including history of housing and homelessness, risks, socialization and daily functions, wellness, and then also the family unit on the family VI-SPDAT. So why was it created? The tool was created to quickly determine whether a client has high, moderate, or low acuity. The tool helps to inform the priority in which households should be served. It was not created to make decisions. Instead, the tool helps to inform decisions being made across the Texas Balance of State COC within CE regions. Especially with our current COVID-19 prioritization standards, the VI-SPDAT score is one of many factors that goes into matching a household with a housing program. So how do you administer the VI-SPDAT? Introduction is key. Some things you can discuss during the introduction include introducing yourself and discussing the purpose of the VI-SPDAT or the FVI-SPDAT that's going to be completed. Taking a minute to kind of explain the process and ensure that the household is comfortable moving forward will help you both to move through the process smoothly. Let them know that it usually takes less than 7 minutes to complete so they know what's to come. Also, we only need yes, no, or one-word answers. And so any additional information that they would need to expand on is not required. Also, any questions can be skipped or refused if they are not comfortable answering them. let the household know that it's also okay if they need to pause or take a minute to collect themselves at any point during the assessment. Next, where is their information going to be stored? In the Texas Balance of State, COC, that information will be stored either in HMIS or on paper. If the household doesn't understand the question, you can provide additional clarification when needed. And lastly, explain that it's important for them to give honest and accurate information during the assessment. There's no right or wrong answers, and there will be no judgment or consequences for any of their answers. So when going through the VI-SPDAT, questions must be read word for word. If a household is struggling to answer a question or doesn't understand the question, as I said, you can provide additional context or explanation at that time. In HMIS or on paper, you should mark an answer for every question. Because the score will be a factor in matching them with housing, it's important not to skip any questions unless the household requests to do so. And I'm going to pass it back over to Lindsay.
Awesome, thanks, Katie. All right, we'll jump back into HMIS. And so the next step is for us to determine which type of VI-SPDAT my household needs to complete. I don't know if everyone knows about this little trick, but if you're ever unsure about your household structure, you can click on this little icon right here. And then I'll be reminded there's no children in this household. It's just my 63-year-old head of household. So I need to complete a regular VI-SPDAT. I'm not going to read through all of these questions for time's sake, but I did want to show you this date field right here. You'll notice it did not backdate for me. It automatically selected today's date. And if you ever don't remember your client's enrollment date, you'll notice that it's right below in that enrollment dropdown. So I need to backdate this to the 28th. You'll also notice that these are the only required questions, these three, on this entire page. So while Katie said you do need to answer all of these questions with your client, the system is not necessarily going to get mad at you if for whatever reason you didn't answer all of them. So I'm going to skip a lot of these, but again, we do want you to fill out all of these questions. And for time's sake, I'm just going to go through and kind of answer some of these and get my client a score of 7 or more. See how we did. Ooh. Okay, so my client scored an 8 on the VI-SPDAT, which you can see in these results here, makes them recommended for either permanent supportive housing or rapid rehousing. There's some more information here at the bottom that you can ask the client to fill in, to give you that information if you want more help getting in touch with the client down the road. And once we're done with this, we'll click Save. We're going to get dropped back off on the VI-SPDAT history page. We'll see that date field here, as well as the type of VI-SPDAT, and then our client's score on the right-hand side. And we always want to remind you that we don't want to share that actual score number with our client. We'll only share the types of housing programs that are recommended for them because of that score. So I'll click Next. And now we come to this VI-SPDAT outcome page. There's a lot of text here, and it's really easy to skip this page, but we really don't want to skip this page. It's very important. So I'm not going to read through all of this, but essentially you'll see at the top that it's time to open up your region's eligibility matrix. This can be found on your region's Google Drive. And I think Katie's going to talk a little bit about that in just a little bit, but in the meantime, essentially, we want to find all of the programs that are in your community that your client is eligible for. And this little score tracker down here will help you out. So you'll see that any of the program types that your client scored for, it'll say the word passed. Whereas if your client did not score for a program, it'll say not enough data. Excuse me. Excuse me again. Okay. So what we want to do here is I really like to make my referrals on this page. We also have the ability to make referrals on the next page, the quick referrals page, which we'll look at in just a minute. But I want to show you why I kind of prefer this page. It's totally up to you which one you want to use. But So I've looked at my my community's eligibility matrix, and I found that there's a few rapid rehousing programs in my community and permanent supportive housing programs in my community, and my client is eligible for all of them. Obviously, client choice is a factor here as well. But when I'm ready to make that referral, I can click on, we call it the blue buddy icon. So I'll click on my little blue buddy icon next to that program type, and I'm instantly taken to make a referral. And you'll notice that first up, our date field did not backdate. So if this is backdated data, we would want to fix our date field there. And then you'll notice that our service or the referral that we're making is already selected for us. So that's really helpful. That's one of the reasons that I prefer making them this way. You'll then need to choose your provider. And I wanted to clarify that we're in the training site, so our providers are going to look a little wonky. We're going to dive deeper into these provider profiles in just a minute, but basically there's only going to be a few since we're in the training site. I'm going to choose Texas Homeless Network, and if you're wondering what that OFC is at the front, that basically means official. It's kind of, think about it like Instagram or Twitter. It's that little verified check mark telling us that this is the official account for Texas Homeless Network. And then our enrollment is automatically selected. I'm going to scroll down a little bit. We're not going to acknowledge this yet because I'm not making it to my own, we'll pretend I'm not making it to my own agency. So the receiving agency would fill this in once they receive it. However, I wanted to discuss this email authorized button. So when we click this and I click save, an email template is going to pop up, and it's going to let me send an email to that agency letting them know that my client has been referred to their organization. If you wanted to CC someone or change the address that this is going to, you can easily type that in here. And you can also type in more information into this box if you wanted to add anything. I'm not going to send this off, but we really suggest that you do this as part of that warm handoff. If you, for whatever reason, don't want to do the email authorized, it's also a good idea for you to pick up the phone and call that agency. So once I've made all of the referrals to all of the agencies that provide these programs that my client is eligible for, again, we want to make as many as we can, I'm going to press next. And I quickly wanted to walk through the quick referrals page. You'll notice this date field also did not backdate, so I would need to change that. Now, if you've already made your referrals for your client, you don't need to do anything on this page. But if you prefer to make them this way, this is where you would do it, obviously. So you'll notice once I click on a row, more rows pop up. Let's say my community has 10 permanent supportive housing programs, so I have to make 10 referrals, and that's going to take a lot of time. This is the page where you could make all of those at once. Unfortunately, though, you'll see that the service is not selected yet, so I would have to go in and find the housing program that I needed, and then sorry, there it is, permanent supportive housing. And then we would select the provider. I want to be clear, you should always select the service before you select the provider. And that's because if I hadn't selected a service yet, it would just pull up all of our providers, even the ones that don't necessarily provide that service. Again, I'm going to do Texas Homeless Network. And one other thing I wanted to talk about was this page is very minimalistic compared to the other way that we made referrals. So you'll notice there's nowhere for us to send that email out. So that's kind of another reason why I prefer the last page. But it's totally up to you. If you know this agency's email address and you can just send them, their own email, that's totally fine. Okay. Let me uncheck this, and it should let me move along. Oh, one other thing. If you are making your referral and for whatever reason you notice that the provider that you're looking for isn't in the system, you should email hmis@thn.org. There might be something wrong that we can fix on the back end. And I believe I'm going to pass it off to Katie to talk a little bit about referrals now.
Thanks, Lindsay. So now that Lindsay showed us how to make referrals in HMIS, let's talk a little bit more about the eligibility matrix and those warm handoffs and tracking referrals. So referrals are the process of connecting people to resources for their immediate needs and to housing and supportive services projects. This involves screening for eligibility. The purpose in screening for eligibility is to match a person to housing that they are likely going to be qualified for, rather than predetermining their eligibility. So in addition, this involves the community coming together to form a participating project list to know and understand all of the resources available in the community. And that participating project list is the eligibility matrix. So the eligibility matrix is a master list of housing resources that are available in the region that includes what services an organization offers and the basic eligibility criteria for their programs. The eligibility matrix is used by assessors when they are making referrals, as Lindsay showed us, so that they're able to make referrals the household is likely going to be eligible for. It's important that all housing resources are included in this list, whether or not those organizations participate in coordinated entry. Many regions also choose to include supportive services on this list, as this tool allows assessors to quickly see what resources are available in the community and allows them to determine if a household may be eligible for services at another local organization without trying to keep track of all of these different organizations and all these different programs in their head. So when making a referral, it's important to both record the referral in HMIS and to make a warm referral in real time. So recording referrals in HMIS allows the community to track how clients are moving through the housing crisis response system. Documenting referrals can help us to see what type of needs there are in a community, where people are going for services, and even what agency they came from for those services. So being able to track referrals can also be useful during case conferencing because we can see what the next steps are after a coordinated entry enrollment. So we can see maybe what agency will be following up next with the household. Lastly, making a warm referral means that the assessor would additionally make a phone call or send an email to the receiving agency to let them know that they are referring a household over to that agency. So this ensures that the receiving agency is notified in real time, as that organization staff may not be able to check HMIS referrals constantly to see new referrals immediately as they're being made. A phone call can also help to clear up any availability or eligibility questions that the assessor may have, or any questions that the household may have. So that's all I have for referrals, and I'm going to pass it off to Linda to talk about unmet needs.
Thanks, Katie. So after recording referrals, you will land on a page where you can record unmet needs. In some cases, you cannot record a referral, and for these cases, you would instead record an unmet need. And so I'm going to take some time and ask a poll question. I'm going to do a little quiz time. Let me close this one. And so I'm going to ask a true-false question. One definition of an unmet need is a service that is available, but the household is not eligible. True or false? Take some time, answer this question, true or false. And again, this is like the other poll where you just click on one of the round buttons. There's no submit button, and I will broadcast results in a few seconds. All right. Okay, so I'm going to broadcast the results now. So about 57% answered true and 42% answered false. The correct answer is true. So an unmet need, there are two definitions of an unmet need, and one of them is that it's a service that is available, but the household is not eligible. So I will provide an example of this later on in my presentation. So what is What is an unmet need? Unmet needs are services that would benefit the household, but they do not exist at all in a region. And as a result, you cannot make a referral for that need. I know that in most of our regions, we don't have permanent supportive housing, for example. And so you could still do a coordinated entry assessment and record an unmet need for permanent supportive housing in the coordinated entry workflow. And like the poll question that I just that we just went through, unmet needs are also services that are available, but the household is not eligible. So one example that I came up with is that there are regions where the housing provider or the only housing provider in a region is a victim service provider. So if a client is not a survivor or not fleeing domestic violence, but that is the only housing program, then you can record an unmet, like rapid rehousing need for that client because they're not eligible due to their housing status. Recording unmet needs are very important because you can pull reports to understand whether there are gaps in the system and where those gaps are. It can also help a community with providing a needs assessment for advocacy or grant writing efforts. So then you can have numbers behind how many folks have an unmet need for permanent supportive housing, for instance. And with that, I am going to pass it off to Lindsay to show us how to record this unmet need.
Thanks, Linda. All right, so we're going to hop back into HMIS and finish up this workflow. We're so close. So we're right where we left off. We're on that quick referrals page, but I already made all of my referrals back on that last page, that VI-SPDAT outcome page. So I have nothing to do here. I'm going to save and close. And now we come to that unmet need page, unmet needs page, like Linda was just talking about. It'll say quick service at the top, but when you look at the services provided, you'll see, or available, you'll see that they're all unmet needs. So like Linda was explaining, there are a couple of reasons why you should record these, and it is so important so that you can identify those gaps in your system and use that for advocacy, grant writing, things like that. So let's say that our client was not eligible, let's say our client was not eligible for permanent supportive housing. We would select that one. And on this reason for unmet need, we have a couple of options here. No funds available at this time, resource not available in the community, or client not eligible. So I would put client not eligible for this one. And I'm gonna record another one too. Let's say our client was eligible for rapid rehousing, but my community doesn't have that resource available at the moment in our community. We would record it like that. And I'm also going to double check that my date field is right, and it's not. It did not backdate for me, so this is another one of those instances. Oops. Oh, I'll press OK. It's gonna, okay, good. Everything's okay. But I'm gonna want to backdate that date, and then I'll press save and close. And we are done. You're done. All steps are completed. Finish, close the workflow, and then we will be dropped back off on our head of households dashboard, and we'll see our coordinated entry enrollment here with our enrollment date. And with that, I am going to pass things off back to Linda.
Thanks, Lindsay. So now that you're done with the coordinated entry workflow, there are still more steps to be taken, and one of them is recording statuses. What are statuses? Statuses are used in a community to tell other agencies about the household's situation. So we know that the situation for people experiencing homelessness can change in many ways between the time they complete an assessment to when they are contacted by a receiving agency for a project opening. Some may leave the area, some may continue engaging with other agencies through street outreach, emergency shelter, or supportive services projects. Statuses are recorded in HMIS under the services menu, and this will be reviewed later in this presentation. And there are two types of statuses. There's a coordinated entry status, or CE status, and active inactive statuses. A coordinated entry status lets participating agencies know where the household is at in the coordinated entry process towards housing. An active and inactive status lets participating agencies know whether that household is actively engaging in the housing crisis response system and still meeting that eligibility for coordinated entry, which is category 1 or 4. Why are statuses important? They're important because they do show up on the housing priority list. The housing priority list is a wonderful reference for every community to look at and see how many people have completed the coordinated entry workflow in assessment. And on this priority list, you can tell with the client what their situation is, and as an agency, understand how other agencies are interacting with them. Because statuses are recorded to reflect a client situation, you may record a combination of statuses at different times. In addition, depending on your role in the coordinated entry process, like entry point or receiving agency, you may be responsible for recording certain statuses at certain times. So one of the first things is we've now completed a coordinated entry enrollment as the entry point. What are the statuses you should be recording? So we've got here, after completing a coordinated entry enrollment, you will record client assessed as a coordinated entry status, as to let folks know that you have assessed them using the VI-SPDAT. And you will also record active sheltered or active unsheltered as active inactive statuses. This lets participating agencies know that the household is actively engaging with the housing crisis response system and is staying in a sheltered or unsheltered location. So shelter here is related to the category 1 definition, right, of shelter, of emergency shelter, transitional housing, or hotel motel paid for by a nonprofit and government funding. So let's take a look at what a receiving agency might add for a client. We know that the coordinated entry process can take a long time from initial assessment from being housed. So after that initial assessment, let's say that a receiving agency has identified a household on the housing priority list and wants to make contact with them for a project opening. In that instance, the receiving agency can use contact attempt number 1 through number 5. And so when other agencies are pulling the housing priority list, they will see that a client has this contact attempt listed under their CE status. This means that they can move on to the next client and not worry about that particular client if they're being contacted by another agency in the community. Now, let's say that the receiving agency did make contact with that household and they want to alert other agencies about what happened in that conversation. They can record the result of the conversation as client declined, client accepted, or unable to contact as a CE status. As you can see in both instances, the receiving agency is not recording an active or inactive status because the client should already have an active status, meaning they are actively engaging in the local housing crisis response system. So next, I will pass it on to Victoria to talk about the HMIS side of recording CE statuses.
Thanks, Linda. All right, so here is a brief screenshot for those who are going to download the slides, but I'm actually going to walk you through the process of adding a CE status in Client Track by sharing my screen. Just give me 1 second here. All right, so in our HMIS, CE statuses are entered in the same way as normal services. Users do not have to be in any coordinated entry workgroup to update a client CE status, but you'll see here just for this example that I am actually currently in the coordinated entry workgroup. From here, you're going to click on Services in the left-hand menu panel under Case Management, and then you'll click on Add New Service. Be sure to select the CE enrollment. Here's the one that Lindsay just took us through, the Texas Balance of State Coordinated Entry Enrollment. And then from the Services drop-down menu, you may need to scroll a bit. I've got a lot of services here, but there's a section header called CE Statuses, and you'll see some of these statuses Linda already covered. Since our client was just assessed, the status that I'm going to select is Client Assessed. Save the page, And you should see that new CE status in the client services. You should also see it on the client dashboard here. So projects will follow this same process to update the CE status as a household is contacted for housing or put into housing, or if the client accepts or declines services. Just to be clear, I mentioned this kind of briefly, I sped through this, but only CE enrollments should be utilizing CE statuses. Do not select any shelter, housing, street outreach, or supportive services enrollments from the enrollment drop-down menu on the services page when you are entering a CE status. We only want to see CE statuses associated with CE enrollments. We'll cover the active-inactive status a little later, and now I'll hand it off to Marissa, who will talk about referrals and provider profiles.
Thanks, Victoria. Okay, so provider profiles. What are provider profiles? How do I find my agency's referrals? And what do I do if I need to add a new provider profile to HMIS? So first and foremost, provider profiles in HMIS are used for tracking referrals made through coordinated entry. So these are living records in HMIS of agencies that provide services across the balance of state. How do I find my referrals or referrals that have been made to my agency? So you can find your agency's provider profile by going to the provider workspace and searching for your agency's name, making sure to select the option that has OFC in front of the name. Like Lindsay stated earlier, this basically just means that it's the official provider profile for that agency as it has been vetted by THN. 3, I don't see the provider profile I need to make a referral to, / I need to add a new provider profile to HMIS. What do I do? So if you are ever trying to make a referral for a client and you don't see the specific agency you need popping up in the list, please let the HMIS team know. We do try our best to make sure that all agencies, all users have all agencies available to make referrals to. So it's really important that you let us know which agencies you need and then the services they provide, and we can update that same day for you. The provider workspace. So you can find the provider workspace by clicking on the double arrows in the blue box at the top of your screen and navigating to the workspace titled Providers. There you can search for your agency via the Find Provider button located on the left side menu. So updating 4.20 CE events for receiving agencies. So a 4.20 CE event is an event recorded by receiving agencies for every household who was contacted to know if the contact was successful or an unsuccessful event. Receiving agencies will go in and update these 4.20 CE events by clicking on the Coordinated Entry Events button located on the left side menu and updating that referral result field. For more information regarding the 4.20 CE event, please look in our data guide and you can navigate to page 30 where you can find more information. Now I'm going to go ahead and pass things back off to Victoria.
Thanks, Marissa. All right, so you've completed the CE intake for a client. You've entered their first CE status. Now what? So let's say the client starts services in your rapid rehousing or shelter program. What's the next step here? So this is an issue that we have seen crop up lately. A client goes through CE and then enters a shelter or housing program, but when we look at the client in HMIS, we only see the CE enrollment and nothing else that indicates the client is part of another program. It is critical that you do a separate intake for your client if they enter your project, because if you don't, that client will not show up in reporting. So when I'm looking at CE data, if I only see a CE enrollment and no other enrollment on the client's dashboard, it makes me think that that client is still being connected with resources or they haven't moved into a program officially. Ultimately, the purpose of CE is to connect folks with services and resources and get them housed. After the initial CE intake, you may need to get your client into shelter, or after a period of time, you're able to connect your client to your housing program. Doing the CE workflow is not the same thing as doing an intake for your housing and shelter programs, or any program for that matter. The CE workflow is strictly for CE. You're going to need to do another intake in the system for your shelter or housing project. Again, this is an issue that we've seen crop up a lot lately, so I want y'all to really take some time to think about this. There is a distinction between the CE workflow and an intake for your normal projects. You can't see me, but I'm doing bunny quotes here, your normal projects. If your client goes through CE and then enters your shelter or housing program, or any other program, we need to see two separate, distinct enrollments on the client's dashboard, and one of those enrollments should have the name of your project on it. So again, I've got some slides that will outline this process for those that are going to download the presentation and review it later, but I'm actually going to walk everyone through the process in Client Track. So let me share my screen one more time. Go back to the client dashboard. All right, so let's go through an example of what this would look like. As we just saw, our client went through the CE workflow. We've assessed them with the VI-SPDAT. We've made referrals, entered a CE status for them. Now we want to get them into our shelter program. Now, before you do an intake for your program, you will need to switch your work group from coordinated entry to a non-CE work group. And this is typically THN Shelter Housing HMIS user or THN non-shelter HMIS user. So you'll click on your name in the top right-hand corner, and we call this the utility bar. And in the work group drop-down menu, I've got a lot of work groups here since I'm one of the help desk specialists, but I'm going to click on THN Shelter Housing HMIS user, but you might also have this non-shelter HMIS user. Either is fine. So before I click apply, keep a lookout on the screen here. This says coordinated entry workflow, but once I click apply, you'll notice that the icons are different. It no longer says coordinated entry workflow. Instead, it says intake. And this is a clue that you are on the right track. So I'm going to click on intake. I'm going to use the current client. Lindsay's already entered all of this information for us. So I'm just going to go through these pages really quickly here. Save and close. Now for this example, I'm going to enroll my client into our test emergency shelter project. I'll leave it for today's date and save. And I'm just going to click on some of these random answers here. What I'm really trying to get across is how different this intake workflow looks, right? So once we finish entering this sort of basic universal data, we have some additional screens. We've got barriers. They've already been filled out. We've got domestic violence. We've got income. So you'll see that there's no chance to complete a VI-SPDAT in a normal intake. And that's by design, right? Because the household already went through that during the CE workflow. A normal program intake is focused on collecting information that HUD is interested in, and data elements displayed here, they may change depending on your funding source, but essentially the normal intake will ensure that you are collecting all of the data elements that are required for your project. And the CE workflow will not do that. This is an example of what multiple enrollments would look like. So it's perfectly normal to have a CE enrollment and then multiple enrollments following it for shelter, street outreach, supportive services, or housing programs. So again, just to reiterate, in this example, we have a client that went through CE, they were assessed, and then immediately they were put in shelter. Now, the shelter services that the client receives should be put under the shelter enrollment, not the CE enrollment. And this is the same if it had been a housing program, right? If your client receives rental assistance through your rapid rehousing program, that rental assistance should be associated with the rapid rehousing enrollment, not the CE enrollment. And in this instance, having a separate shelter enrollment right here ensures that this client is going to show up in my reporting that's focused on my shelter project. And now lastly, just to drive things home, we're now going to add in that active sheltered status that Linda mentioned earlier. We're just going to get in some extra practice here. And again, like I said earlier, you don't have to be in the coordinated entry work group in order to add CE statuses. We're just going to go to Enrollment and Services, click on Services, and then Add New. Again, we're going to want to make sure that we select the Texas Balanced Estate Coordinated Entry Enrollment for the CE status. And then under the Active Inactive Statuses section, I'm going to say that this client is active and sheltered. Save the page. And when we go back and look at the client's dashboard, we should see the 2 CE statuses that were entered for the client. So just to recap, only use CE statuses on CE enrollments. Do not apply services like rental assistance to the CE enrollment. That will not show up in ESG or SSVF reporting, for example. And if your client moves forward with participating in your program, do not just leave the HMIS side of things at the CE enrollment. We need to see an enrollment for your program too. So I will stop here and hand it back off to Linda.
Thank you, Victoria. So now that Victoria has shown us how to switch work groups so that you can toggle between coordinated entry and your own project intakes, let's talk about exiting from coordinated entry. And when I'm done talking, Marissa will show us how to exit a client from their coordinated entry enrollment. According to our Texas Balanced Estate Continuum of Care Coordinated Entry Written Standards, we exit clients from coordinated entry when they are in a housing program and have a move-in date, like rapid rehousing and permanent supportive housing, if they are otherwise known to have found housing, and if they are deceased. For all other households, we keep that coordinated entry enrollment open. This is because coordinated entry is tracking people's progress towards housing, and if they are still engaging with the system, with the housing crisis response system, because they are in need of housing, we need to keep their enrollment open. This also allows for reassessments to happen every 6 months per client choice, so that you don't have to create a whole new enrollment for the client. Exiting someone from coordinated entry is important because it helps us track the length of time it took for a household to be connected to housing, from the VI-SPDAT all the way through to a move-in date. So I want to just go back to what Victoria had talked about in terms of multiple enrollments. Because coordinated entry is a community-wide process and ultimately in HMIS, a community-wide program, it connects households to connect households to housing. It is possible for a client to have multiple enrollments, including coordinated entry. So I'm going to go through an example here. So let's say on 6/14, a client entered an emergency shelter. And then after 7 days, the client states that they would like to be connected to housing programs. And we have identified that there are no other options for the client, like connecting to friends or family. So they are enrolled into coordinated entry and complete the VI-SPDAT, and they're still staying in that shelter. Now let's say that several days later, a rapid rehousing project has an opening, and after discussing with the client would like to enroll into that project. As you can see from the purple, blue, and orange, there are 3 enrollments for this client. Now, the program is working with the client and now has a move-in date of 7/1. That date becomes the exit date of coordinated entry. I also hypothetically chose 6/30 as the exit date for emergency shelter, as that client is moving into an apartment, for example. After exiting from shelter and coordinated entry, the program continues to work with the client with case management, rental assistance, and other services. So just wanted to provide this example for everyone to understand the multiple enrollments piece. I'm a visual person, so this helps me understand visually what that looks like. I also wanted to provide a screenshot of what this looks like in HMIS. So this is a client that has 3 open enrollments that started at 3 different times. So you've got coordinated entry, shelter, and rapid rehousing. And then the next slide, this slide includes exit dates. So you can see different exit dates of like the emergency shelter was a little bit before coordinated entry and a little bit, which is the equivalent to the housing move-in date. As you saw in the previous slides, you exit the household from coordinated entry when they are housed, either through a housing program or in some other fashion. And when this is the case, in addition to exiting from coordinated entry, the receiving agency will also record 2 statuses. So they will record client housed as the coordinated entry status, and then they will also record inactive permanent housing as the active inactive status. We also have statuses for the other, for client deceased as well, and inactive client deceased, should that be the case for the client. So next, Marissa will show you how to exit a client from coordinated entry.
Okay, so how do you exit your clients from CE? So first, you want to make sure that you're in the correct work group. So making sure that you are in a coordinated entry work group. And then once that is verified, you will click on the blue action button next to your client's coordinated entry enrollment on their dashboard. And then you will select the option that reads Exit Diversion / Coordinated Entry Workflow. It is also important to note here that exiting clients from coordinated entry is a community-wide effort, meaning that regardless if you are part of the agency who originally enrolled this client into coordinated entry, any user can exit a client from CE. So if you know that this client is in permanent housing, or if they've moved in with friends or family, you can exit their coordinated entry enrollment to reflect their current housing situation. Adding and updating coordinated entry statuses for exit. So once you exit your client from coordinated entry, it is extremely important to add a CE status via the services menu. Adding statuses to your clients helps communities to better manage their housing priority list. If you are attempting to add a coordinated entry status and don't see the header CE statuses in your drop-down menu, please let the HMIS team know. If during this meeting you attempt to add a CE status or an active-inactive status to one of your clients and you don't see the services pop up in your services menu, please send an email to us right away and I will make sure to give you access to those services as soon as possible. So now I'm going to pass things back off to Linda to go over active and inactive statuses.
So you'll notice in the list of statuses that we've been showing you today under the services menu, there are a lot of active and inactive statuses, and I'm listing them here today. They all mean different things, so I've also included kind of their definitions on the right side here. These statuses are really tied to whether your community is using the active households policy. I will state there only are a few communities in the Texas Bounds State that are using this in order to keep their housing priority list up to date manually. So what is the active households policy? I have it at the bottom of this PowerPoint here. The policy states that a client becomes inactive if they were assessed by coordinated entry and have had no contact with any entry points, system navigators, and or community outreach for 90 days. And they have had no services or shelter stays in HMIS in the past 90 days. The purpose of these statuses is to focus our energy on those who are actively engaging with the system. We know that folks can disappear or go missing, and so it's just a way for us to track those who do go missing and why they go missing, or those who got into permanent housing as a way to keep the housing priority list up to date and also keep each other up to date on these clients. And like I said, only a few communities are using this active policy to keep their housing priority list up to date. I want you to focus on the ones that we focused on today, which are the active sheltered, active unsheltered, inactive deceased, and inactive permanent housing. So one of the ideas that we have for a future training is a deeper dive into the housing priority list. I don't want to go into that these statuses today, but I wanted to highlight them for y'all because you will be seeing these in the system, in HMIS. And then next, Marissa will talk to us about resources.
So resources. We understand that the whole coordinated entry process can be quite difficult to understand, so I think it's really important that we carve out some time to talk about where some resources live in order to help you navigate through the coordinated entry process from beginning to end. The coordinated entry resources page is located on our website, thn.org, under the header titled Texas BOS COC, and then selecting the option that reads Coordinated Entry in that drop-down menu. Once you arrive on the coordinated entry page, you will see a button that reads Resources for Coordinated Entry Regions at the top. So these are just a few resources that we have available for our users and assessors. So first, we have the Coordinated Entry Written Standards. Second, we have the Coordinated Entry Manual, which is a manual we created dedicated to help our users understand not only the process of coordinated entry, but to help you all find any and all resources in one combined PDF or location. It is also divided into chapters just to help you all navigate through it. Number 3 is our Diversion and Coordinated Entry HMIS Data Guide. So this is a guide all about diversion and coordinated entry in relation to how it works inside HMIS. You will find step-by-step processes of how to do an intake, record a service, record a referral, and adding statuses. Number 4, we have reviewing the Litmus training courses. So you can always review your old CE HMIS training videos in Litmus. These are incredibly helpful videos, and I would recommend you bookmarking the Litmus training page just so you can go back and review it anytime you have any questions. And number 5 is our CE training requirements infographic. So this infographic walks you through the steps you need to go through in order to have CE access in the live site. I know a lot of the time it can be confusing to understand where you are in the training process, so I recommend viewing this infographic as it lays out all the steps you would need to go through as a new assessor. So now I'm going to pass it back off to Linda to talk about next steps.
Thanks, Marissa. So talking about a little bit of next steps, like I alluded to, we do have ideas for future trainings. This particular training is mandatory as it is a CE refresher for our CE HMIS users. But for future trainings, we were thinking of non-mandatory topics that we could go into. So one of them being coordinated entry in the housing priority list, a deep dive into how to use it to communicate with other agencies in your community. Another training would be serving survivors in coordinated entry. So a deep dive into how to use the workaround process in HMIS so that survivors can get connected to housing resources. This is particularly useful if you have a victim service provider serving as an entry point in your region. And so those are just ideas for future trainings. We are also open to any other ideas that you may have in terms of future trainings that you want further information on, and we are more than happy to work with that as well. The last thing I want to note is we do have a survey for today. We would like your feedback on today's training, as well as your community's coordinated entry process. So it's a Google form that I just put in the chat. You will also receive an email from Adobe Connect with this link as well. And so we would love to hear your feedback on today's training and also about how coordinated entry is working in your community, what's working, what's not working, and whatnot. So feel free to complete that survey today or in the next few days and give us your feedback. And with that, we are at the Q&A session. So we've got a lot of time left. We want to keep this time open so that you can ask questions about coordinated entry. There's a lot to coordinated entry. We recognize that, and so we are here to help answer any of your questions today, and also hear your feedback on some things that we may not have covered. So we know that we just covered some of the topics that we have seen come up again in the past year and a half, and we did not go into details on other pieces. So if you have any questions or if you have any scenarios, things that you want to talk through, please put them in the chat, and we are here to answer any of those questions. I'm going to change the PowerPoint so that we are at the beginning, so it gives a good overview about what we just went through. You can probably hear my mouse going. There you go. So here's the agenda, quick overview of what we talked through today. Please let us know any of your questions. We are here to answer them. Just a quick note, we've got web links here. These are direct links to all the resources that Marissa pointed us to. The files pod is underneath the chat pod, so that PowerPoint is right there for you as well. We are here to answer questions. I'm gonna stop talking so that y'all can gather your thoughts and ask any questions or give any comments at this time. All right, so Rosara writes, how do we know who is the one that does coordinated entry in the county that you reside? Okay, so we have a coordinated entry training request, which is open to the public. There are tabs to that. One of the tabs being 2021 CE HMIS users. This is a list of all HMIS users who have access to coordinated entry in HMIS in your region. And so I'm going to copy and paste that here. Also, if you're curious about who participates in coordinated entry in your region, all that information is also on our THN website under coordinated entry as well. If you scroll towards the bottom, there's the resources for CE regions. It will list out the counties, and then it will direct you to the Google Drive where there's a ton of information by region of who's participating, policies and procedures, all of that good stuff so that you know who is in your region. And I want to talk a little bit about when you're going through a VI-SPDAT with someone you are very familiar with, their history, housing status, and instead of refusing the answer, they are answering no to questions that you know or feel very confidently that they are a yes, thus making their score lower. If anyone has experience with this and how you deal with it, please feel free to also respond to Sarah. From my perspective, it is definitely a hard stance to want to answer that for them when they are answering that question no. I think reiterating the fact that telling you the more information, the better, in reiterating that as a way to get them to answer those questions based on what you know. At the same time, I think this also is a good way to talk about case conferencing and using that space as a way to advocate for that client and just state that, you know, knowing the history of that client, I'm advocating for them and knowing that I think thinking and explain your situation the way that it is, right? The other thing is you can also do an assessment review request, and per client choice, ask them if they want to do it again at a later time. Maybe some time has passed and you're still thinking about this assessment. You can submit an assessment review request and get that through your coordinated entry planning entity for approval and redo that assessment at a different time. You know, sometimes it's not a good time to do it, things like that. So utilizing the assessment review request, reiterating that, providing more information is better. And then the third option is advocating for that client during case conferencing meetings when you're talking to other agencies about that client.
Linda, I was going to jump in too, if you don't mind. I witnessed an HMIS user one time doing a VI-SPDAT with someone staying in their shelter, and they answered no to one of the questions related to medical history, and the client said no, and the assessor kind of gently reminded them, you know, hey, don't you actually take medicine for diabetes or something like that? And he was like, oh yeah, I do. So maybe, and I think some people in the comments are kind of saying the same thing, just gently remind them that there's no judgment, and the more information is actually just going to help match them to services better.
Thanks, Lindsay. I'm just trying to scroll up there. Marilyn, I did type that in. So any new provider profiles that you want to add into HMIS, you can send them to hmis@thn.org. We also like to have information on like contact information, address, and also any services that they provide so that we can put all that information in at once. And so HMIS@thn.org would be your best place for that. Okay, Emily writes, and we currently have 2963 active CE clients and only 273 have been exited since April 2018. How do we know where clients who we refer to rapid rehousing go if receiving agencies don't report back to us or even participate in HMIS? That's a great question. I think that alludes to a community case conferencing in terms of getting to understand those clients. I know that there are a lot of clients because the list has been, coordinated entry has been around for a long time, that there are a lot of clients. I think one of the key things is having that case conferencing meeting so that you can understand where those clients are at and utilizing the statuses such that, like, let's say out of that 2963, like 2,000 of them, are now in permanent housing or missing, right? Then you can utilize those active and inactive statuses to mark them as such. So it really focuses more on those statuses rather than open coordinated entry enrollments. One of the things is if you do have a huge list of clients, not trying to do data cleanup for every client, but like setting a date of like, we're going to start on January 1st, 2020. Any client that came in, we're going to like start there and like clean up, quote unquote, clean up as much as possible coordinated entry, right? And so just you as a community understanding like from January 1st, 2020, that's when we set the date of when we're looking at clients regularly and in real time. And if you want to talk offline too, specifically for Corpus Christi, let me know and we can talk through that as well. So Linda, I think you were in Brown County. So from my understanding, with ESG, that your organization had homelessness prevention, and so coordinated entry. We may not have spoken to you about coordinated entry because your program is homelessness prevention for ESG. But if you're interested in that, I can connect you with the coordinated entry steering committee member and joining Abilene or talking to Abilene in terms of their coordinated entry process. Any more questions? Like, feel free to put them in the chat. We're here to answer your questions. We've got a lot of time left today.
So I'm seeing a question, this is Katie, by the way, I think a little while up we may have missed, from Sherry Williams, saying if a client indicates that they want to be referred to a survivor service provider, should a referral be made and not continue with CE? And so in that case, I would say that one would be partially up to the client choice. If they want to go to a victim service provider or a survivor service provider as safety is their main concern, they would need to continue with coordinated entry at a later time and go to that service, their survivor service provider for services at their current point in time. If they would like a referral to a survivor service provider, but it's not one of their top concerns and they indicate that they want to continue with coordinated entry where they're at, then that's also fine too for them to continue with coordinated entry and then also make a referral for the survivor service provider.
One thing I wanted to highlight that Marissa walked through is our THN website on the coordinated entry page. We have a lot of resources there, a lot of them that we walked through today. There are even flowcharts, process flowcharts that we've published on the website that can help you if you're a visual person like me to walk through the coordinated entry process. We've got the CE manual, which are a set of infographics. So a lot of different ways to talk about coordinated entry to help you navigate that as well. So just a lot of resources out there, and we are also a resource too. I just wanted to put that out there. All right, everyone. I don't see any more questions coming in. Again, like I said, we didn't go through everything. We know there's a lot of details to coordinated entry, but we wanted to provide a brief refresher overview of the intake process and the post-intake stuff. Thank you so much for being here today. And please let us know if you have any questions about coordinated entry, any questions about HMIS. We are here to help y'all. And feel free to stick around if you have any more questions. We've got the survey that we would love you to complete so that we have some idea of what happened today and also what we can do better for next time. Thank you so much for being here today. If that's it for everyone, I think we can adjourn the training. Thank you.